Okay, so we're going to talk now about premature rupture of the membranes. And you need to know a couple of different acronyms. The first is PROM, premature rupture of membranes. That's different from SROM and AROM. SROM is spontaneous. AROM is artificial rupture of membranes. Both of those can be used to refer to when the membranes rupture during labor. SROM can also occur before labor begins, which is spontaneous rupture membranes before labor begins. If the patient is full term and the membranes rupture before labor begins, it's considered PROM, premature rupture of membranes. Okay, so you got to remember all these ROMs. AROM is artificial. That's going to be done during labor or to start labor. SROM is spontaneous. It can occur during labor. If it occurs before labor, but the patient's full term, then it's also considered PROM, premature rupture of membranes, even though they're at term. Premature means before labor starts in this case. Or if they're also preterm, if they're before 37 weeks, then it's PPROM, preterm premature rupture of membranes. So take a minute to write all those down and get them all straight, okay? The risk factors for premature rupture of membranes or PPROM. Black women in the US are at greater risk for both. Any inflammation or infection of the urogenital tract, uterine contractions, increased intrauterine pressure, so twins, increased fluid, larger baby, a history of preterm birth, a history of cervical surgery, a shorter cervical length in the second trimester. So if they're monitoring cervical length with ultrasound, if it's shorter, that's a risk factor. Uterine overdistension, I think we covered that one. Second or third trimester bleeding, the risk is greater. Any kind of pulmonary disease. So your patient has asthma, greater risk of PROM or PPROM. Sorry. Any connective tissue disorders, so any kind of disease process like Ehlers-Danlos or those other conditions that affect connective tissue. Poverty. Patients who are poor are more likely to have these issues. Low BMI, so if they're very small, very underweight. Nutritional deficiencies, especially copper and vitamin C, and smoking. So those are all the things that make it more likely. Now, if the membranes break, PROM, before onset of labor, what are the risks? Well, once the water is broken, the risk of infection begins to go up. And if the baby's not delivered within about 24 hours after that water breaking, then the risk of infection drastically goes up. That infection would usually begin with chorioamnionitis. The membranes become infected. If that happens, that infection can be transmitted to the fetus. There's also a risk if the membranes break before labor of placental abruption, retained placenta or hemorrhage after delivery, cord prolapse, or cord compression. Okay. Now, if it's preterm, then it also can stop lung development. So we can have pulmonary hypoplasia in the fetus. Because remember, the fluid has to be there to provide pressure for that lung fluid to move in and out and cause development of the lungs. Management of this. So if this happens at term, the very first thing we want to do when water breaks, whether they're having contractions or not, full term or not, we want to make sure that they haven't had a cord prolapse. So we're going to look for signs of cord prolapse or cord compression. So the first thing you want to do is assess fetal heart tones. Okay. Aside from that, we want to prevent and monitor for infection. So that patient gets instructions. Now nothing goes in the vagina. Okay. We want to minimize vaginal exams to only when really necessary once their water has broken, because the more exams we do, the more risk of infection. So if their water's broken and they're not having contractions, we really want to avoid increasing that infection risk. If they're not in spontaneous labor and they're full term, usually the provider is going to go ahead and induce labor. Now, they might do that immediately Some providers may wait an hour or so and see if they start to labor on their own. They're not going to wait a really long time. The longest I've seen is if you're not in active labor within maybe 12 hours, they want to induce. A lot of providers are going to do it sooner than that. Okay. Now, what if they're preterm? Okay. What if they are not 37 weeks yet? So between 34 and 37 weeks, there's kind of some differing ideas about what's best. And some providers are going to go ahead and be conservative, wait for labor to start on its own. Some, if it's closer to that 37-week mark, are going to be a little more aggressive about trying to get the baby delivered because of infection risk. But typically, most commonly, they're going to be admitted until delivery. Most providers are going to wait, if they're not 37 weeks, most providers are going to wait until labor starts on its own, but they're not going to try to start it. So they're going to admit them, try to prevent infection. So avoid vaginal exams, avoid anything in the vagina, and good hygiene. We want to make sure that patient's getting good perinatal hygiene. They should have an NST and BPP at least daily while they're waiting for labor to begin. They need daily fetal movement count. So we want that patient to be aware of fetal movement and let us know if that changes. If they're between 24 and 34 weeks, they need glucocorticoid shots to mature the lungs. If they're less than 32 weeks, they're going to get mag sulfate because they're probably not going to go very much longer. They're going to get prophylactic antibiotics because the water's broken. We want to prevent infection. We're monitoring for them for signs of labor or for signs of infection. So the mom's temp is getting checked every 2 hours. We're doing those NSTs to see if the fetal heart rate is higher. If they begin to labor, it's usually not stopped, but sometimes if that patient needs to be transported, they may get tocolytics just long enough to get that transport done. If they develop signs of infection, then labor is going to be induced because at that point, to prevent sepsis, we need to get the baby delivered. Okay, the next thing we're going to talk about is post-term birth. So babies born late after, that's going to be after 42 weeks.